Max, I don't think you can trust nutritionists. I think they're, yeah. Okay,
Neither.
well, end of podcast. No problems at all.
Yeah. And I think the important thing, always I talk about it with people a lot.
Yeah.
I'm a nutritionist. So are you. You know? So it's not like we're coming at it from the point of view of you can't trust a physiotherapist. You know, because we're not physios. We don't know what physios do. So I guess that's where I'm kind of coming from, is that I literally am one and I don't think you can trust them.
Yeah, absolutely. It's a loaded statement, and I think there's so much behind what we're actually talking about here. For context, there's a lot of difference between nutritionists, dietitians, naturopaths, personal trainers. They all provide nutrition-oriented services. I think let's jump into things and really break down what is the differences between them. Can you trust a specific type of one, or is it more so like a blanket statement? I very much encourage you not to reveal too much, because of course we want to make sure that people listen along to actually get the answer towards the end. Let's discuss first off, what is the difference between, if we can summarize in education, we'll go through education, scope of practice, client types and structures, fee structures and payments, and then red flags to avoid all of these kind of scenarios overall. The differences between education between dietitian, nutritionist, naturopath, and personal trainer is fucking ginormous. Like it's ridiculous. It's probably one of the biggest variances in terms of service providers of, let's say, health-oriented practice that you can see. That's quite common, but they all operate with a similar clientele, with a similar field. And I feel like majority of people don't really know the difference at all. And I think the difference is so large that if you get mixed up and you are unable to determine the difference, it may end up costing your life, which is a bit of a bold statement, but in some instances, absolutely. It's one of those like, hey, this is the kind of situation that we're playing with. Max, take me through, what is the education of a personal trainer?
Yeah. So personal trainers, the education is essentially just a diploma. In Australia, we're talking about in Australia. We don't know about other countries. And this is for, we're Australian, so we talk about for Australia. A diploma, so you got 2 certificates of Cert 3 in fitness and then a Cert 4 in personal training or fitness or whatever it is. And that's how you become a personal trainer. It can take anywhere from, I think, potentially years, 1 to 2 years, all the way as little as around about 6 weeks or 3 months or something like that, depending on which course you go through and how fast you want to do it in and all of that. So firstly, from a standpoint of time, when we look at the fact that you could potentially do the course in a matter of weeks to a few months, it doesn't really matter what you're doing unless your job is a very, very simple job where there's very few steps involved. You're not going to be able to learn enough information in that amount of time. It doesn't matter what you're doing. It doesn't matter how smart you are, whatever it is. Having weeks to learn something is not enough time to learn any given craft. So right at the bat, when we're looking at education, there does need to be that standpoint of that, well, how long has this person actually spent learning this thing? Do you think that's an important, it's definitely not the be all and end all. For example, someone could have been learning something for 10 years, but if they haven't been learning the right things or haven't been trying very hard, 10 years is
yeah, like you can go through and
well.
do an entire university level course and come out to be a chiropractor just to realize that your entire business is a fraud and you're not actually helping people. But that's a separate topic for another day. I completely agree. I think 6 weeks for, I'm not entirely certain if that's the exact time frame, but it's something really, really small where it's like,
I don't think
okay,
so. I think it's a bit short.
Barely noticeable in terms of, hey, that's just a blip on your total life radar. And if that's like your entire thing is, okay, I'm providing people specific exercises and performance, I think there's a lot of issues with that, full stop. And I think a lot of people don't realize that, hey, there's a whole area of health performance being exercise physiologists who are the kind of, if you were to, I'd say it's probably more so relating to nutritionists jump to dietitians is the same jump from personal trainer to exercise physiologists. It's like, it's not even comparable in terms of the content that they know. And there's so much variance between personal trainers as well. Everyone thinks they have a certain mantra, a certain idea. Often it provides an aspect of someone new to the industry, new to the health industry, has certain ideals, have certain, let's say, fads they subscribe to, and can often provide, hey, it's a kind of status of authority. Hey, I'm a personal trainer. I do this for a living. I do this to support people. It can be quite tricky. Then again, personal trainers are kind of that reputation based. Often it's not just personal training that they do. It'll be like a dietitian and personal trainer, which a few of our colleagues and students in our cohort were. It'll be a doctor and personal trainer. It'll be something else plus personal trainer, scientists or something along those lines. So they're relatively well-educated individuals, but the variance is bloody huge. So it really depends on where you're coming from. But overall statement, yeah, it's such a short time to kind of say, hey, this is now my profession. Like I can do everything exercise-wise, but I don't know. It's tricky. What are your thoughts there, Max?
Yeah, 100%. No, exactly. And I think I've done comparisons to car guys in the past because I feel like it's a good way to get my point across to you specifically because you love cars. I feel like there is similarities here with the personal trainers and car guys in the sense that it doesn't really take much to qualify yourself as a car guy. You know, you just got to kind of care more than the next person about cars. But then the variance, I'm sure, and you can confirm or deny this, but I imagine the variance would be massive. You know, I imagine there'd be some car guys that would know heaps about cars. It would just be unbelievable, their knowledge. And there'd be other car guys that it's like, wait, what did you just say? Like, aren't you meant to know things about cars? And you just said that? It's like they know less than when they started.
Yeah,
almost.
You've got the car guy who knows the logos, and you've got the car guy who dismantles engines on the weekend.
Yeah. Yeah, well, exactly. And you've got all the variants, just like you were saying, there's a massive variance and variation. You've got everything in between there. And then you've got car guys who are actually mechanics who have qualified themselves, and they might know a lot and they might not know a lot, especially compared to a car guy who's been, just you were saying, they would assemble his own engine. He might not be qualified at all, but he might know a hell of a lot more than the actual qualified mechanic kind of thing. So with all these things, we are making big, vast generalizations. And when we say things like personal trainers, if we come to some sort of a conclusion that whether they can or cannot be trusted, that is not about every single personal trainer ever. There's heaps of personal trainers that both Matthew and I know who are extremely intelligent and well thought out people, but that's not because that's what they learn in their personal training course. I think that's the big differentiator here. They've learned things outside of their course.
Yeah,
and
they get that certificate to be like, okay, hey, I can coach someone in a quote unquote safe manner through my personal training course. Yeah, exactly. It's a legal piece of paper that says, yeah, you can do that kind of stuff. But it's their knowledge was there way before the personal training course, or they've done the personal training course and acquired it later on. Yeah. But I think the reason why we're talking about personal trainers today is because often we find that personal trainers are prescribing meal plans and diet plans and things along those lines, which kind of enter the scope of practice of dietitians specifically. And we'll talk about that later on. I don't want to give too much away just for now, but keep that in your mind that we're all talking about nutrition and health overall. And often we can kind of move over in terms of someone's scope of practice. And we'll chat about that in a second. But in terms of education moving forward, would you like to chat about anything personal training wise or move to nutritionists? Perfect.
Nutritionists. Yeah.
You can walk out of this door. You, the listener, I'm talking to you right now. You can walk out of the door that you're currently the room that you're in and call yourself a nutritionist. It's an unprotected title. You don't need anything to be a nutritionist. You don't even need to do a course. I'm pretty sure there's no legal reprimand that can come after you in terms of that kind of thing. And that's why we say we don't trust nutritionists, because it's a very scary thing. There's university level qualifications that can get you to a point where you can sign up to the Nutrition Society of Australia and be it a quote unquote accredited nutritionist or whatever that means. It's a very useful thing to be assigned to an organization, a governing body, absolutely, but nobody fucking knows what that is. Nobody even cares. Like, if I walk down the street and say, "Hey, I'm a doctor," man, that's big words. I'm not a doctor right now. That's absolutely not what I'm saying at all, and you can get in massive trouble for doing that. But if you walk down the street, "Hey, I'm a nutritionist," and people often get confused between nutritionists, naturopaths, dietitians, PTs. Yeah, look, it's super tricky. The education of nutritionists. I know of a couple quote unquote colleges in Melbourne CBD who provide nutrition courses that's like 2 weeks. And it's just like, what can you possibly learn in 2 weeks that we've studied 5 years for? And we're apparently on like the similar level in terms of the perception of the greater public. It's ridiculous versus the pathway we went through, Max, where it's a 3 years bachelor's, then you move on to a 2 years master's to become a dietitian. And that's probably the biggest differentiation is, hey, there's a lot of variance in nutritionists as well. PTs often call themselves personal trainer and nutritionist. And again, unprotected title, 2 week course, just to say, hey, I've got something below myself. It's one of those, you can fall down a very slippery slope if you're not careful, and people often find that it's a Dunning-Kruger effect. They think they know way more than they actually do.
Yeah. Oh, look, there's so much to unpack there. One of the big things, because I talk about this with people a lot, because people are curious. I don't really have much of an ego around the whole nutritionist versus dietitian thing. People call me a nutritionist all the time. I don't care. They can call me what they want, because especially they can call me what they want. One, because I don't care, and two, because they don't know the difference anyway. So there's no point correcting them being like, "Excuse me,
actually,
I'm actually a dietitian." And then I think, yeah, exactly. And then I think that also brings, because I'm consistent in the way I describe myself. I always describe myself as a dietitian, nothing else. So if I'm always describing myself a certain way and they're using different language, that's pretty noticeable. So then that generally strikes up a conversation around, what's the difference between you keep describing yourself as a dietitian? What's the difference? And I do explain to them the difference. And I think, just like you were saying, Matthew, you said your words were you think the majority of the population doesn't know the difference between a nutritionist and dietitian. I would go much beyond that. I would say 99.9% of the population, or there and thereabouts, don't know the difference between a nutritionist and a dietitian. Reason being, I've had this conversation with dozens of people. Zero of them have had any idea around what the difference is. I didn't know until I was probably in my
I'd probably say second, third year. And I'm like, okay, so what do they do differently? Yeah.
So I think that's a fair call, that the people studying it didn't even know for a little while. It's not like it's complicated or anything. But one of the biggest things, Matthew, after I went on my rant, that I like to describe to people is that despite there being, this whole idea that, if you go down the proper route for a nutritionist, then you're a good nutritionist, being, as you were saying before, getting that undergrad degree. I even push back against that significantly. Reason being is we did it. How much nutrition did we actually learn in that undergrad? In my opinion, it was very, very little. We spent the first year doing chemistry and physiology, second year doing anatomy and biochemistry, and then the third year doing a little bit of nutrition and some other electives, whatever you wanted to choose. And it's like, well, we didn't really learn. We learned a hell of a lot in masters, that was for sure. But the undergrad, so it's like, okay, we've got all these nutritionists out there who are the good guys, right? Because they're not the ones who did the 2-week course, and they still haven't actually learned much formally around about nutrition, which is, what do you have you thought about that much? What are your thoughts around that?
Because you go into university expecting, hey, I'm going to finish this course being really comfortable with giving people nutrition advice, and you're just not. I've spoken to, and through Latrobe, I do a mentoring program where I mentor some other students who are looking to get into the field and explore different pathways for career choices. And it's often budding nutritionists who are, hey, I'm really uncomfortable getting into the kind of world. We haven't really been taught how to actually provide nutrition education. And then they're kind of, at the end of it, they're like, oh yeah, by the way, nutritionists, and kind of jumping the scope of practice, nutritionists don't really work with people with disease. So that's a nice twist. Like, hey, you just spent 3 years doing a bachelor's, and now you can't work with majority of the population because everyone has a disease to some extent. And it's like, okay, well, that's a massive gray area. What's going on here? And that's very frustrating in the sense that even if you've got a bachelor level qualification, your scope of practice may not be what you're expecting. And the education you've received is, again, it's almost like a fundamental, where I would liken it to, this is a really great situation, a really great baseline for where you will then go on to actually learn about the more interesting things of nutrition overall, how to apply it to specific health scenarios and provide amazing health advice to a general population. In terms of where you go from there, Max, do you want to add anything before we jump on to naturopaths? Remember to check the link in the description or our website for our consultations. Back to it.
Yeah, man. No, I think, you've hit the nail on the head there. And I think it is interesting you talking to those nutrition students, because I too, I've spoken to many. I've spoken to many that are either coming out of high school, so they're in year 12 and they're about to decide what uni they want to go to and what course they want to take, as well as early, like budding nutrition students who are very early in their course. The way I always describe it, and I think it sounds like you're on a similar path here, I literally describe it as 1 5-year degree. It's not 2 degrees. It's not a bachelor's or master's. It's 1 5-year degree, because you don't stop at 3 years. That's not an option for you, because that's nothing. I know when we graduated together for our bachelor's, we really didn't care about it at all, because we didn't see it as anything that resembled anything at all. The reality is that it's essentially you must do your masters to be, get a more likelihood of a career and a job out of it rather than just doing the bachelor's. And that's really important. So that's what so if there are people who are listening who are thinking about it, that's something you really need to consider. This isn't a 3-year degree. It's a 5-year degree, and you shouldn't be, it's great to celebrate at the end of your 3 years. That's awesome. But you really should be still head down to make sure that you're not going to miss out on getting that master's.
The job security is always a factor in the nutrition health sphere. Again, part of the reason is because of this exact conversation we're having right now, is that nobody knows the difference between nutritionist, naturopath, dietitian, PT, whatever you want to call it. Everyone's competing for the same kettle of fish, and the normal person doesn't really know or doesn't really care. They think, you seem to know a little bit because you can label off a couple of micronutrients and a couple of statistics, and hey, this works with this pathway, and apparently now I'm a smart ass and not going to know everything. Slippery slope, man. Really slippery slope. But no,
you don't even need to know that much.
It's an interesting thing. So bachelors definitely provide an amazing foundation. You have the ability to critically analyze literature. You have the ability to critically determine what is the appropriate outcome of this specific scenario. What is the realistic conclusion from the data, the consensus that we are looking for. A lot of nutritionists who do not have that bachelor's accreditation and personal trainers aren't able to do that, which I think is incredibly worrying, because now they're just getting their information from Karen's third cousin's sister who had this specific disease and this happened to her. So now I'm a keto guy and that's how it works. So it's one of the scenarios where, yes, absolutely, bachelor is incredibly important, but then the additional education of how to actually apply it to your specific population, how to specifically apply that to clients in an effective manner, comes from that master's plus on for like moving further. It's really interesting.
You know what's interesting, Matt, is we always say, I think we might have been a bit wrong. We always say that, one of the most important things about nutrition is you need to be able to sift through all the lies. You need to be able to determine what's true and what's not. And it's like, well, I don't know if that's necessarily true, Matt. I think we've potentially been wrong, and I think we've been caught up in that whole, because that's what everyone says, right? I reckon we don't actually do that. We just call everything. If we hear anything new, our immediate reaction for like a good 3 to 6 months is no,
just denial.
So it's not even that you need to get good at determining lies and truths. It's just like you need to get good at being like almost a bit disagreeable, I reckon, in that you build your foundation of what you believe, and then you get really good at being disagreeable. If someone presents something to you, you just don't buy it. And then if it is compelling enough for you after a prolonged period of time, after you vet it out for a little while, that's when you actually start to sort of change your views.
That's an amazing way to think and phrase things if we're specifically thinking about how I would apply it to my client consultations, because it's either a yes, you do recommend it, or no, you do not.
Right.
But in terms of how I approach, let's say, understanding a certain topic, omega-3s are probably one of my favorite nutrients. I think it's such an interesting area, but there's so much gray in terms of, hey, it may do this and it may do that, but it may not do this. And it's more so of like a 0 to 100. If it's like for improving, let's say, brain development in children, I'm more of like like 80 to 90% sure it actually does something, versus it's like, yes, it absolutely does, versus no, it absolutely does not. Like it's one of those things where nutrition science is so gray. And again, that's where I probably lean towards like, hey, yeah, the bachelor's really applied the ability for me to determine it's not just one or the other. It's potentially a whole factor of scenarios. Plus, it doesn't matter if it's 0 or 100 in this scenario, if there's so many other factors going on behind the scenes. Like it's like, oh yeah, I'm malnourished and I have multiple diseases and deficiencies, but if I have omega-3s, everything's okay. It's like, no, mate, we need to look at the big picture of this entire scenario. It's not just you specifically with the omega-3s.
100%, man. Yeah, I think that's really well said. Is that it is extremely grey. That's what I love about it most, to be honest. Now, naturopaths, I literally know nothing about them. Reason being is I don't really care about them at all. They're not on my radar in any sense. I've never been confused as a naturopath. I don't know why. Maybe because the people I tend to associate with are younger, and they also don't tend to associate with naturopaths. I feel like it is a bit of an older generation thing. They may start to die out actually as time goes on. Oh, who knows? We might see a bit of a wave, but I feel like we are in a bit of a dip at the moment for naturopaths. You can confirm or deny. Take me through, man. What's the education?
So interesting. So often I find that naturopathy in general it goes in ebbs and flows. From the COVID situation, where we've had a lot of distrust towards the Western medical system, I found that people are turning more towards naturopathy because they're untrusting of how the government's handled, especially in Victoria and Australia, how governments handled the whole COVID crisis and epidemic. It's a shame that those people are going to get burned twice. Because, yep, you've been burned by the Western medical system. Man, you're going to get fucking burned by a naturopath. It's just a matter of time. The main problem with that is that there is even more variance between practitioners of naturopathy, if you can even call them that, than there is of nutritionists or PTs. Because in the similar manner where you don't need any qualification to call yourself a naturopath, it's even worse because there's not necessarily a university level qualification that can provide you, hey, you have something or other in naturopathy to what I'm aware of, or to what's industry respected. So often I find that people are going upon recommendations, and it'll be, look, I've met some amazing naturopaths in my time, very evidence-based. I would liken them similar to my level of experience and or education because they've gone out of their way and they're actually learning. They're not just kind of going with the whims and the woes. Versus some other naturopaths where I've had calls with them, I've had chats with them, and it's, yeah, I've got this vibration tool that you put it on your kidneys and it magically increases your EGFR from 20 to 90. And then it's just, where did that come from? And for people who don't understand gobbledygook, that means they can pretty much cure all disease with a couple of humming and ha's. Look, if that works, cool, take my money, no problems at all. But there's so much snake oil I've been exposed to in the past 5-10 years that my skeptical hat goes on firmly and backwards whenever I see a naturopath walk into the room. I'm like, okay, you need to prove to me now that you're not an idiot. And that's a shame because I think incorporating aspects of Eastern medicine, of non-alternative medicine is really important to actually providing an outcome for the client individually. We're not going to have evidence for every single thing. So exploring other avenues is absolutely appropriate. If I was with a life-threatening illness that's really ruining my quality of life, I'm absolutely going to explore alternate measures. But it just sucks so much that if you go to a naturopath, you're not going to get the experience that you're looking for. Most likely it's going to be multiple different ones before you actually find one who's going to go through the rounds appropriately, and more importantly, isn't just going to take your money. Because I've been exposed to naturopaths in the past where I've gone with a client, just no charge or anything like that. I wanted to learn what they do, and they sat them down and they did some genetic test that they outsourced to a different company. They charged them $600 something for that, and they just read off of the piece of paper. And then through the piece of paper, it was also contradicting itself. It's like, yes, you can't have red meat because of the cholesterol, blah, 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 blah. But also red meat isn't bad for you because of XYZ reason. And you don't have to worry about the cholesterol. And then plus after that consultation, it's, hey, we think you would really benefit from 50 different supplements. Buy all of these. And it's only $700 per fortnight. Don't even worry about it. It's not even a big deal. And looking at the supplements, the quality is trash. They haven't been batch tested, or the of like a homeopathic variety where it's the quality and the quantity of the actual nutrient is so low that I would not even feed it to my dog. It's like, why would you bother just putting an absolute like filler of a capsule into your dietary intake thinking it's going to work? Then again, look, placebo is one hell of a drug, and if placebo works. I guess that's why the entire naturopathy business is still going. But that's generally my experience. I apologize for going in a bit of a rant there, but it's a bit of my passion area of mine.
No, look, and you got me thinking about this. Is a little bit off topic, but really important to mention this because it's important to contextualize it. I think I wish I had said this at the start. Like 25 minutes in, I wish I had said it at the start. But the biggest thing to take away, if you don't know this, you probably know this inherently, but you haven't actually thought about it consciously. The point of having these degrees is like the point of having a nutrition degree, a master's degree, and dietitian, a mechanic, a carpenter, plumber, whatever it is, teacher, anything, is when someone comes to you from a different field, they know you at least have a bottom baseline of knowledge. So at least like, well, look, if I go to a mechanic, I have no idea who he is. Had no recommendations from friends. Google doesn't exist. Whatever it is, at least I know he's a qualified mechanic. So he knows more than me, because I'm not a qualified mechanic and I don't know anything about cars. So this dude's going to be able to help. Probably. And it's kind of the same for like everything else in life, right? Like when you call up the carpenter or whatever it is to fix your house, if you know nothing about carpentry, because you can't check to see if this dude's doing good work. You don't know what to look for. Like you just got to just trust the guy. And so that's essentially what degrees are useful for. And that this person's met a bottom standard of like, okay, we'll sign off, good to go kind of thing. And I guess that's what these things are for, which naturopathy doesn't have. That's what personal training is for. If you know nothing about the gym, at all, but you want to get stronger, fitter, whatever it is, then a good way to go about it would be to go see a personal trainer who at least knows something. At least that person has that bottom baseline of knowledge that you're going to learn from. So it's good in a way, in that the world works that way. But as we're saying, what we're talking about is everyone is obviously meeting this bottom baseline of knowledge. It's the variation between them. And I don't think we see that with naturopathy, unfortunately. Let me just quickly fix up my internet.
Yeah, I completely agree with you on that one, Max. Can you hear me okay? There we go. Is that better?
Okay. Yep, cool. So yeah, I think you heard most of the ramble, Matthew, in the sense that basically it's a really good way for, because I know nothing about cars, I can trust that a mechanic's going to, as long as the dude's not a complete scam artist, I'm going to be okay.
Yeah, it's that baseline.
But we don't have that with naturopathy.
Yes, unfortunately we don't. And there's
and unfortunately,
yeah. Sorry, please go on, Max.
Take it. No. I like a 10-minute ramble. So
It was it's really tricky. It's really tricky because yes, there are qualifications you can have as a naturopath, but the normal person isn't going to vet them and go and actually understand it's okay, cool. This guy's a naturopath. He has his own thing. He has his own website. Looks pretty good. Looks pretty reputable. Off I go. And it just gets really sketchy because it's like, hey, we're going to do some breath testing. And then, hey, we're going to do this test. And then, hey, we're going to do that test. And it's so many tests, but they don't produce any outcomes that actually result in change. So it'll be, hey, we're going to test your gut microbiome and determine what your microbiome formation is and the dysbiosis that they have in these fancy words to make sure that you're probably getting a service or whatever it is. And you would investigate it. Hey, what are you actually getting out of this scenario? What outcomes would that change? And they go, oh, it would determine how much probiotics we give. That's like, why wouldn't you just give the highest dosage? If you suspect there's a dysbiosis going on, why wouldn't you lead towards it's unnecessary testing just for the sake of it? And if we did that in the Western medical practice, that would just lead to higher rates of false negatives and false positives, where we're just getting diagnoses for the sake of getting diagnoses and potentially treating something that doesn't need to be treated. It's all about the quality of life and if the treatment will actually improve the outcomes of the person's situation versus just doing it for the sake of doing it.
Yeah, no, 100%. 100%, man. Yeah, it's something that's, and it's good the way the world works that way, in the sense that you don't need to be an expert in every single field. You can trust people who are, and they have qualifications to back that up. But yeah, it is scary in places like naturopathy and places where we might feel like the bar's a little bit too low. Maybe the bar's a little bit too low for personal training. Maybe it's not. I don't know. What else are we going through? We've gone through education quite a lot.
We're jumping into
what other topics we going through?
Scope of practice. So who can work with who and where does it apply to? So jumping straight into a dietitian's perspective. So just so we're absolutely clear, dietitian means in Australia that you need to have a bachelor of some level of nutrition and moving into a master's of dietetics practice as per we were doing it. That's a 5-year course at the moment. Previously was a bit shorter, but they've increased the requirements primarily because I think universities like to make money, but it was a necessary education, full stop. The scope of practice of dietitians is let's start with the bottom first. Let's go personal trainers. Who can personal trainers work with? Your general person looking to get healthier, may or may not have an injury, but they cannot specifically treat the injury. So that's reserved for physiotherapists, not occupational therapists, physiotherapists, your osteopaths, maybe chiropractors if you like pain and like not getting outcomes, but that's a different story. In terms of nutrition, personal trainers legally can't provide nutrition advice, as far as I'm aware. Yes, they can promote healthy living and promote healthy dietary intake, but in the same sense that if a nutritionist or a PT or a naturopath provides a meal plan or provides a specific dietary structure or a specific therapy or guidelines for a specific disease and or chronic state, they can be liable for a lot of damages if they potentially cause some harm to the individual. So I would say it's exactly the same as a random citizen providing that nutrition level of therapy care, specifically medical nutrition therapy is the claim that we're making here, where dietitians are the only ones that can legally provide that in a safe manner that's been vetted and it's evidence-based. So if you're looking to manage your diabetes or your osteoporosis or potentially cholesterol or something like your overall health, blood pressure, things similar to those nature, dietitians are your route and your choice. If you're looking for general health advice, then a lot of those individuals that we previously discussed, naturopaths, nutritionists, PTs, can provide healthy advice and healthy guidelines. Eating your fruit per day, 2 serves of fruit per day, eating enough veg, eating enough protein, having enough total fiber in your diet, all those things they can absolutely do. But when it's specifically, hey, you need to eat 3 eggs per day to make sure that you're not choline deficient. It's like, okay, are you doing the assessment for choline deficiency? How are you determining this? What is the dosage of choline you're provided? And is it going to even improve their specific outcomes or symptoms? It's one of those scenarios where that's the scope of practice where I specifically want to make it absolutely clear. Dietitians are providing medical nutrition therapy for specific chronic disease states where nutritionists, naturopaths, and personal trainers provide general healthy advice for government guidelines as long as they're reputable.
Yep, exactly. And all dietitians are nutritionists, FYI. And what it also means is that whilst we have these extra things that we can discuss with people or provide, doesn't mean we are not capable of doing the same things that nutritionists do, for example. So if you're someone who is looking at, if you're just a healthy person, just wanting to get feel healthier, feel more energetic, fitter, stronger, happier, whatever it is, you wouldn't look at, because like in some fields, for example, you'd look at like, okay, let's go to the person that specifically does that, which would be an example might be if you're going to, should I stick with the car theme or not? Yeah, we'll stick with the car theme. Like if you're looking to, like if you're going to someone, if you were trying to race your car, go to take it to the track and race it, you would go to like a specific mechanic for that's good with the racing cars. I don't know if they exist because I don't know anything about cars, but let's assume they do. Whereas if you just have your Corolla, you're going to take it to a regular mechanic, right? It's a little bit different in the whole dietitian sphere because we literally are the race mechanic and the in one person and the regular Corolla mechanic in one. So it's not like, oh, you go to the nutritionist to see your general health person, all that. It's like, nah, we're still going to be better.
I'm a little bit biased. I think so. But in the same sense, I can almost guarantee there are nutritionists out there that are way better than some of the dietitians that have graduated. I think it's really important to note that just because you have a qualification doesn't mean that you're amazing. Know one. Oh, absolutely. Absolutely. Shout out to Will Wong. He's fucking awesome. Really great bloke. Great bloke. In terms of the providing of those services, I think it's really important to know exactly what we've mentioned so far, but specifically the types of clients that come along. It's really tricky because if you're a normal person, you generally have some things behind the scenes that aren't absolutely amazing. And look, I'm personally biased. I think that every person should go see a dietitian at least once in their life, probably more towards the middle age to the later years, because realistically, you're going to have at least 2 to 3 deficiencies, full stop. And ensuring that you're not deficient in those specific items is really important to ensure that your health span and your longevity is really important. And and continuing to improve, which is a huge factor. I don't believe that a lot of nutritionists and below can provide that specific service without just throwing some supplements at you and calling it a day. And even then, the supplements that they choose or provide may not be the ones that actually improve your current situation and or get you out of the deficiency state.
Yeah, no, exactly. Look, as with all these things, we're always going to promote us because we think we see it as important. It's like the same as, I'm sure every accountant would say like, oh, don't do your taxes because like it's better to go see an accountant. And that's probably true, like that's probably true. Same as, I'm sure, and same as accountants would also be saying, just like how we would probably say promote, for example, I think things should be more nutrition education in schools. I don't even know if I do believe that. Maybe that's a bit of a hot take.
That's a whole separate conversation. Stay tuned for the next podcast. We'll discuss should nutrition education be in schools.
Reason why I'll just do a 10-second teaser. Reason why I have that opinion is because I know the education would be awful. Yeah. So it almost feels like they would be unlearning things, similar to like the whole naturopathy stuff we were just talking about before. How sometimes it feels like when you speak to people, it's like you've almost like regressed. You've unlearned basic things that are common sense to everyone else. But anyway, like same as like when you hear people saying like, oh, I'm not going to eat fat because I don't want to get fat. It's like, hold on. 99% of the population just knows like you eat more, you gain weight. Eat less, you lose weight. But you've like literally gone beyond that. You've regressed yourself beyond that. Anyway.
Okay. Got absolutely behind.
I never know where I was going.
I'd like to specifically
I know where I was going to say.
What my specific situation and qualifications are is I'm a dietitian and sports nutritionist. That's generally how I kind of introduce myself. The reason I don't say I'm a dietitian and sports dietitian is one, because I'm not a sports dietitian at the moment. I'm technically a provisional sports dietitian. Two, it's a whole thing with the process. Two, I don't actually intend on continuing to upkeep my sports dietitian accreditation just because I don't work with those athletic individuals on that long-term basis. Plus it's an additional fee, which I don't really want to pay. And it's more of a thing we'll discuss later on. It's a few $100. Yeah. And it's okay. Yeah, it's the education that the sports nutrition course provided me from Sports Dietitian Australia was the important thing out of that entire scenario. I didn't do it for the qualification. That's why I say I'm a sports nutritionist, because yes, I'm not overstepping my bounds. I don't have that baseline level of, hey, I'm a continuing to improve sports dietitian. Yes, I know absolutely way more than your average dietitian in terms of sports nutrition, but that doesn't mean I'm an active sports dietitian. It's important to exactly explain, hey, that's my scope of practice. If you're in an athletic sport team and you're the absolute best of the best, you're competing in Man U or you're going to the Olympics, go see an accredited sports dietitian, because they'll provide a better service to you than I would, because that's not my ideal population. My ideal population is the normal person who's looking to improve their health, but also would like to meet someone who knows a little bit more than your average person in terms of sports nutrition and performance, because I think it's important to acknowledge those areas. Yeah. Do you have any comments?
100%. Or even someone that recognizes, just really quickly, even someone that these people recognize as someone that's intelligent. So for example, I think you know this dude, Eugene Teo or whatever his name is, the Asian dude from Melbourne.
Yes, I do. Yep.
Do you know him? Yeah. He has 0 qualifications, but he is recognized by lots of very, very intelligent people as being very, very intelligent. Mike Isotell hangs out with him all the time. He's got people with, PhDs in exercise physiology that he's hanging out with and having intellectual conversations, back and forth conversations with. So it's like, that's a little bit of vetting too. Maybe this person doesn't have a certification, but who are they associating with? Who wants to hang around with this person? And that I think that's really important.
Yeah, absolutely. The same goes in the opposite direction though. So I've noticed a fair few doctors online who are outstepping their boundaries, also who coincidentally are chiropractors who call themselves doctors online, which I think is hilarious. And they provide these kind of recommendations from a nutrition perspective, which are completely outlandish and ridiculous. And I don't understand how they're not pulled up on from a legal perspective, where it's just where are they coming from? What is this information you're providing? It's total trash, but you've got the label of, hey, I'm a doctor, so I must know what I'm talking about behind you, which I think is absolutely ridiculous. So it's important to know that the following someone has can be an indicator of their knowledge and status, but can also be the complete opposite, where it's a completely different environment, a different population that's subscribing to these individuals, where it's kind of the easy to get food, the Herbalife customers, the isogenics customers, the ones that kind of throw money at the problem, hoping that something will work when it never does. It's an interesting situation.
Yeah.
I'd love to jump onto fees and structures of payments, Max. Do you have any comments before moving on?
Really quick. I saw a really cool post, and I think you liked it too, from, I keep talking about Instagram, Dr. Arnold, what's his name? You know what I'm talking about?
I think I do. I can't pronounce his surname.
The obesity doctor dude?
Yeah.
Yes, the Arnold S something. And it really put into perspective doctors' education around nutrition overall for me, because, we learn as dietitians, doctors only have 1 week. I don't even know how long they spend on nutrition, 1 week in nutrition or whatever it is. And which is super true. It's not much at all. It's very little. And that's just the reality of things. If it was more important to them, they would study it more. That's the reality. They're like, we can have our opinions of, they should study more. They should do more nutrition. It's like, well, there's a reason they don't. It's because it's not that important to them. And the other reason is almost all of them literally have a dietitian right there.
Yeah, we exist for a reason.
Ask.
Yep.
Exactly. So it's like they probably don't need to do the nutrition for a reason, and they've got more important things to focus on. And I think he did a really good post a few weeks ago, a few months ago, that was saying I only did a week of nutrition in med school. It's like, well, that's like still 40 hours more study than what you did. Cool, like what do you want me to do? What do you want me to do about it? It's like I've still studied way more nutrition than what you did, and also because of my base knowledge that I already had, from like understanding physiology and chemistry really well already, being a doctor. 40 hours was like super speed 40 hours, because you didn't need any of the background, so you can just like literally get straight into it. So that's an interesting thing. Like, not saying doctors have good nutrition knowledge by any means at all, but it is something to note that it's still 40 hours more than just about anyone else on the planet.
Quick ad break, guys. Remember to click the first link in the description to check out our dietitian consultations and services. Back to it.
Yeah. I've had some interesting interactions with some gastroenterologists who, for the normal person listening, they're gut doctors. They're like usually gastrointestinal doctors who specialize in that area. And if it's things like sensitivities or pain or hypervisceral sensitivities overall, their recommendations aren't exactly usually amazing. It really does depend, again, the variance between that gastroenterologist practitioner who's actually providing the therapy, who's providing those details, and if they're referring to a dietitian in an appropriate manner. Because half the time when it gets to kind of, hey, we think you maybe might have IBS, but we'll try some things over here first, then I almost think it's an inability to let go of the situation and provide the pathway to a dietitian, and kind of holding on to the client too much, where it's, yes, you've established that there's no internal bleeding, there's no celiac disease, there's no IBS or IBD, there's no IBD, and we may get an IBS diagnosis. It might be the time to refer on to the dietitian who is IBS trained, like myself, shameless plug, where we can actually provide that service.
Why didn't you tell yourself that? You said dietitian sports nutritionist plus IBS.
I can. I usually assume that most people don't care that it's hey, you're an IBS guy, you deal with IBS clients. I think it's more of like hey, you're a dietitian, you must see IBS.
IBS is the craze now.
What's that? What next?
IBS is the craze now, I reckon.
Oh, look, it's becoming way more prevalent, and the average diagnosis time of 6 years is slowly reducing, which is good. That's a really good sign, but it also means that we need to ensure that the pathway is adequate, and it's not just kind of your medical gaslighting experience where it's, hey, I'm got a really upset stomach, don't really know where to go, I'm going to try a naturopath, or I'm going to try a nutritionist. And it's like, look, man, you're so close. You're so very close to getting to where you need to be, seeing an IBS trained dietitian. but you're just not getting there. And it's really frustrating because the level of education needs to be applied to the general health sphere. I would have loved to go through my education in my bachelor's or my master's to actually understand, what does every other health practitioner do? Like, I'm familiar with physios, I'm familiar with osteos, occupational therapists. I'm like, what do you exactly do? How do you kind of fit in?
No, they're easy.
Oh yeah, but like it's
easy.
I would love to have a further understanding, and I think the same applied to some other practitioners would be amazing. Just like, what does a dietitian do? Oh, they're the weight loss guys. Look, no, they're not just the weight loss guys. There's like so much more than that. I hope we've conveyed that information in this episode, but I think that's an interesting thing. The key reason why I have a problem with gastroenterologists holding onto patients so much is that the fees that these doctors charge are so much higher because, of course, their education and their quality of service is of that level of standard. But at that point in time, the client doesn't need that level of education. They don't need that constant assessment of, hey, has the IBD come out of nowhere again? Have you magically got the genetic disease celiac or anything along those lines? That's the point where you should be funneling over to our dietitian. And it's important, very specifically, a dietitian for those IBS situations, because if you go to a naturopath, you may get a really reputable, really good naturopath, but chances are you're going to get one that funnels you through their specific supplements and their specific homeopathy routine and their specific tests that do something or other, trying to fix some magical disease that doesn't exist, or you got leaky gut or whatever it is. We can talk about that at a later time. That's a very interesting conversation. The fees associated with some of these less reputable individuals, such as your naturopaths and maybe some personal trainers, and less so nutritionists because they're more so on the nutrition-oriented bachelor and or university level qualifications. It's absolutely insane, the difference between these kind of situations. And just something to keep in mind, that just because you throw money at a problem doesn't mean it's going to get fixed. And that's a really sad thing in this situation. It's more so about applying your own advocacy to your specific situation and your own pathway to get you to where you need to be, which in this specific scenario of IBS is to see an IBS dietitian. It is the full stop therapy for treating and making sure that you actually get the care you need.
Well, as an IBS dietitian, I know we're talking about fees. I'm just really curious. Averages around about 6 years or so to get a diagnosis if you do have IBS. What do you think would be an appropriate timeline for? Because it's obviously not going to be straight away, because there does need to be a time frame. So, what do you think would be an appropriate time frame
in terms of symptom kind of situation to diagnosis?
Symptoms. Yes, yeah. Symptoms, they have the symptoms for however long, go see a doctor. From the first time they see the doctor to diagnosis, what do you think would be an appropriate time frame that we should be aiming for?
It's
just off the top of your head.
It's really hard to say. I think I would have to estimate within 1 to 2 years would be appropriate. I think 6 years is pretty ridiculous because, again, I think that 6 year point, once you pass that 1 to 2 years where you've ruled out celiac disease, you've ruled out any bleeding, you've ruled out any structural abnormalities, you've ruled out any IBD that might be going, inflammatory bowel disease that might be going on behind the scenes. You've ruled out some other conditions that might be going on. Probably take that 1 to 2 year kind of bracket, depending on your doctor and your advocacy and how you're going with the treatments and testing procedures. Then once that point,
and things happen in life as well.
Absolutely,
things pop up.
Absolutely. Yeah. But I think that kind of once you're past that position, it's more of a, hey, going to see my doctor every 2 months or so. It's, look, man, I'm really uncomfortable. Kind of still got these symptoms. Nothing else is coming along. It's like, oh, okay, maybe try some ginger tea and see if that helps. And then nothing helps. And it's like, okay, maybe try peppermint tea this time, see if that helps. And then it doesn't help. And then the doctor might recommend something else ridiculous, like maybe try keto, see if that helps. That one might help, but only if you're cutting out the specific FODMAPs that you're sensitive to. But that's a complete coincidence. You haven't actually applied the low FODMAP dietary personalized strategy. So look, it's really tricky. And I feel really sorry for these patients because I've had some absolutely horror stories in the past. Where it's like, yeah, I've had these symptoms for like the past 18 years and it's kind of just been like, that's my thing. I usually get it and then I'm out for 3 or 4 days because some IBS can be really, really bad. Such an interesting area.
Well, exactly. And that was the reason why I asked the question, because 6 years does seem like a really long time, especially for a diagnosis when, for example, if you go for other diagnoses like heart attack or cancer, if you have the heart attack, you know very quickly. Same as cancer. If you have cancer, you get the test and you know very quickly. So 1 to 6 years does seem like a very long time, but that's just why I did want to ask that question because I had a similar time frame in mind. So it's not like we're ever going to get it down to a matter of hours or days or minutes. It's still going to be a prolonged period of time that these diagnoses will take. But yeah, 6 years is still too long for sure.
Yeah, yeah. And yeah, it's really, really interesting. The irritable bowel syndrome, meaning IBS, is one of those areas where it's, hey, dietitians are the point of therapy. If you don't respond well to a low FODMAP diet and personalization, I think that the really important factor is the personalization that comes afterwards, and or potentially gut-directed hypnotherapy via either a dietitian or an additional practitioner. It's very tricky to provide that therapy overall. That leads us on to...
For sure.
Yeah, let's get back to red flags. So our final topic of today is red flags of all these health practitioners overall. Often I find the easiest way to spot a red flag is promises. If someone's promising you, hey, you will feel better after this, I don't know that. Even as an IBS dietitian, where we've got the leading way to provide that therapy to these clients, I only have a 60 to 70% success rate with that specific therapy for that individual client before moving on to some additional ones. That's a likely, hey, yeah, we've got some pretty good therapies. That's even higher than some medications in some instances. We're most likely going to be able to alleviate your symptoms and improve your quality of life, but I can't guarantee that. But I think sometimes some, let's say, underqualified professionals can come along and be like, yeah, absolutely. Look, man, if you lose 3 kilos, you're going to feel so much better. Chances are, yeah, absolutely, you will. But you don't know that. There's no promises. There's no certainty in this situation. Medicine is inherently a very difficult scenario to make promises in. It's all likelihoods and chances and percentages, not blacks and whites, yes or no binaries.
It's funny because surgeons seem to speak in very black and white terms.
Yeah. They're doing very black and white things. So if
they're also very confident people.
Yes, they absolutely are.
You have to be to get into that.
Yeah, well, I've seen very similar with some GPs where their confidence level is very high, but again, they're exaggerating. So if their confidence is around that 70 to 80% point, they may exaggerate to the point where like, yeah, no, you will feel better. Yeah. And potentially the factor of telling the client you will get better is so much of, a positive placebo response that being confident, being comfortable that they're going to feel better if they stick with this medication or they stick with this therapy or they stick with this kind of exercise regime, that confidence in, and that, hey, my doctor told me if I do this, I'll feel better. And it's like, oh, I feel a little bit better. Oh, maybe I feel a lot a bit better. That's potentially a factor in this scenario, which I unfortunately am unable to provide because just from a moral perspective, I think just in the off chance that it doesn't improve your current situation or there's another factor that comes later in the line, I don't want to be in the position of, Matt the dietitian lied to me and now I'm not feeling better because he told me blah, 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 blah. Now I've wasted X amount of money and X amount of time.
Dude, I'm the exact same. And I was just thinking then, surgeons, why would surgeons be like that? Obviously, it's a confidence thing in the sense that you kind of have to be a little bit brutal, similar to people who make it to elite sports. You have to have this extreme level of confidence in yourself to get there. Like surgeons are kind of the same, like there's only a few of them out there. They don't. So you need to have this confidence, but you also need to sell yourself, right? Because a lot of times people see multiple surgeons. You don't just go to the first surgeon and go under the knife. You might see a few, see which one you feel most confident in. And if 2 of them are saying, yeah, look, 50-50, might get the job done, might not, see how we go. And one of them's going, mate, I've done this 10,000 times. This will be easy as, don't worry about it. Hop under right now. I know who most people are going to see as pretty. So there's that element too, in that they do have to sell themselves.
It's a sales pitch regardless. And I think that's what dietitians suck at in general, is that they suck at selling themselves. You're competing against people who, instead of doing a bachelor's and a master's, they spent their time learning how to market themselves. They spent their time on Instagram mastering the algorithms instead of actually getting the education they provided. And now they're really great at selling a service, but not so great at delivering one. So I think that's an important factor of hey, look, man, that's another red flag. Unless they've got actually enough evidence to back up what they're saying, and they're making claims that you can't dismantle without jumping to a few different spots. Something to keep in mind.
No one's going to be able to know that though, bro. Like, it's like the same as like if I I like them. I like the car stuff because I know nothing about cars, so it works really well for me. You know, if a car guy was talking absolute nonsense to me, and I wouldn't even know where to start to think about like dismantling or trying to figure out how he's saying. I've just got to essentially trust him or not trust him.
Where the qualifications come in handy.
And that's pure vibes.
Cool, you've got a baseline of a master's. That's a pretty good starting point at least. Yeah. Then the next jumping point would be specifically red flag on pricing. If they're charging ridiculous amounts and they've got to get used to a subscription service, I think that's pretty scary environment. So as an accredited practicing dietitian, I can't provide subscription services to my clients through a dietitian. I can as a nutritionist, which is a bit of a gray area. But if you're coming to me and be like, hey, I need treatment because of my, let's say, my osteoporosis is really bad and I have an inflammatory disease. I'm like, okay, no worries. Here's a subscription service where you need to pay me on a weekly basis so I can improve your health. I don't know how long it will take and if it would actually provide any outcomes that are meaningful to the client. I can't guarantee that my subscription service is going to equal the result you're looking for versus a personal trainer who it's, hey, I'm looking to improve my health. I'm looking to just get fitter. They're absolutely capable of providing a subscription service because they're not providing a medical nutrition therapy in any manner. And I think it can be really tricky. So if I was just a little bit of a foreshadowing, if I'm making an enrichment program where it's improving multiple aspects of your health overall, but not specifically tailoring to a specific disease, then I can make a subscription service that works towards your life overall. But it's one of those tricky things. Hey, subscription service, already a red flag. Then additional on top of that, the pricing is really high. So it's kind of above your kind of standard level or ridiculously above because they provide X special service in quotations. And it's you need to have your nose turned up and the peg taken off to smell if it's fishy. And if it's like, hey man, I'm getting taken for a ride here and I'm not really getting much out of it. Very tricky. But then again, price perception is the thing. So the reason why we don't price our services in particular with ridiculously low prices is because if we did it at $20 an hour, nobody would take us seriously in the sense that everyone else is charging ridiculously high. And yes, we may waive fees here and there because, of course, people get in trouble positions and we need to provide the service full stop. But we need to ensure that one, we can earn an income, and then two, you're actually getting what you're paying for. So yeah, that's a whole separate rant, but make sure that you're comfortable with the level that you're providing your financial assets and you're not getting taken advantage of money-wise, which is too common with the naturopaths in particular.
Most definitely, man. Most definitely. Matthew, thanks for this wonderful chat.
My absolute pleasure, Max. Have an amazing day, everyone.
You too, Matthew. Good chat.
Luigi.
Brony.
Bye-bye.
Luigi, sorry.
Thank you so much for listening to the R.E.A.L Health and Nutrition podcast. The sponsor of today's show is you. You support the show by listening and using our services of dietitian consultations and performance coaching. We offer in-depth one-on-one consultations to help you achieve your health and performance goals. Any random bloke online can give you a generic meal plan where we here at R.E.A.L work collaboratively with you to reach your goals, making you feel heard and including you in your journey's planning. Our service offers tailored advice and can accompany meal plans and or realistic nutrition strategies, which can be booked via our website, www.recoveryexerciseandlifestyle.com. That's www.recoveryexerciseandlifestyle.com. Just a quick disclaimer, this podcast is for education, information, and general entertainment purposes only and does not constitute the practice of medical nutrition therapy or healthcare of any discipline. The content discussed in this podcast is not intended to be a substitute of professional medical advice, diagnosis, or treatment. Please review our terms of use via our website. Thank you so much, everyone. Have a great day.